Good afternoon, everyone. Thank you all so much for joining us today. We are really excited to have one of our great partners with us. Hope Family Health Center will be giving us a presentation today on wellness beyond diet and exercise. And this afternoon, we have Hilda with us that will be giving us our presentation. So Hilda, I will turn it over to you.
Thank you. Good afternoon, everyone. So welcome and thank you, Ms. King and Unidos contra la Diabetes and everyone that is here today. So for today's Lunch and Learn, I'll be taking a holistic approach to diabetes treatments with an emphasis on mental health, so wellness beyond diet and exercise. So like Ms. King was saying, so my name is Hilda Colunga. I am a behavioral health consultant intern at Hope. I'm also a public health graduate student at Baylor. So as a BHC, my biggest role has been providing evidence-based brief interventions and supporting the healthcare team. So within this scope, I have been able to develop additional intervention skills during my training as a BHC, as well as implementing a lot of my research focus, which has been health disparities among the Latino population, diabetes prevalence rates, diabetes awareness prevention, and treatment programs. So there's been a scope, an area where I draw a lot of passion from, just because it continues to be such a great public health, important public health crisis. And as an intern and graduate student, there are many areas where I wish to continue and learn, but I've been able to adapt a lot of this information that I've learned into this presentation, as well as additional peer-reviewed articles and information from national databases. However, I welcome all feedback. A lot of you may be specialists in a lot of these fields. So I welcome all feedback, and any questions you may have, please feel free to put them in the chat, and Ms. King will continue to monitor the chat, and any questions directed towards me, I can answer those at the end. So here's a brief outline of what I'll be talking about today. The 4 steps that I'll be talking about are going to be the national standards from the National Institute of Health on how to manage diabetes, but my emphasis will be on the mental health component with coping with diabetes and in cognitive behavioral therapy. So why is this important, right? So diabetes continues to affect 37 million Americans. And these rates are even higher in Texas and in the Rio Grande Valley, putting us at about a 14% prevalence rate, which is higher than the national average, which is about 10%. And this is important and significant because Latinos are disproportionately affected by diabetes at a 1.2 times rate than their white counterparts. And this is, again, important because, as we know, in the Valley, over 60% of our population down here are Latino, so that it puts us at an increased risk for diabetes already. So these are the 4 steps that I'll be talking about. The first will be learning about diabetes, knowing your diabetes ABCs. Step 3, again, that'll be where we spend most of the time, will be learning how to live with diabetes and get routine care to stay healthy. So the first step, learning about your diabetes. And I know there's been past lunch and learns about this. I'm just going to briefly talk about this. And the 3 main types that we know of is type 1, 2, and gestational diabetes. Type 1 being accounts for about 5 to 10% of all diabetes, and it's typically early onset because it is a genetic disorder. So whoever, those that are predisposed to it usually typically get diagnosed pretty early on in their life. With type 2 diabetes, this is the one that is most common. And we hear about the chronic illness that develops, typically has a later onset. However, we are seeing it earlier on with children, and early adolescents, as well as adults. And typically it's induced by behavioral and lifestyle choices or metabolic syndrome. And gestational affects about 2 to 10% of all pregnancies. So knowing your diabetes ABCs, this convenient mnemonic has been created by, in collaboration with physicians, as well as specialists in the field, to help patients advocate for their health and keep track of maintaining their health. And it's because these 3 different components of diabetes maintenance is important in order to keep their health. And so it's made it convenient so that they can keep track of them as they're managing in their everyday life and when they go in for routine care. So the A stands for A1C. So we know that's a blood test. It measures one's blood sugar levels over the past 3 months. The goal is to maintain that A1C level under 7 for diabetic patients. However, we know that this number isn't realistic for all patients, and it doesn't look the same for everyone, right? This can look different. And so the encouragement is for patients to talk to their physicians about this number and what is a target goal for them. B is for blood pressure. Again, with diabetic patients, it's very common to have comorbidities, one of them being hypertension. And this is an important one and a dangerous one because it is also known as a silent killer. So making sure that the patients are aware of what those numbers look like for them, what they should maintain their blood pressure under is also important. And this, again, is not standard for all patients. So continuing to remind them to talk to their physicians, their PCPs, to know what that number looks like for them. And the last one is cholesterol. We have both types, right? LDL and HDL, one being bad and good. There isn't no standard number. So the patients are encouraged to talk to their physicians and to see what that looks like for them, what normal is for them. Because again, once you have diabetes, those normal ranges don't always apply to all patients. Those can range. So why these 3 categories, right? Why A1C, blood pressure, and cholesterol? So together, these 3 things can help lower chances of having a heart attack, a stroke, or other cardiovascular problems. And this becomes even more riskier for diabetic patients, right? Because it's already affecting their cardiovascular health. So making sure that they are keeping track and always maintaining those additional components in check will become important. Step 3, so learning how to live with diabetes. And this is the biggest component, right? So our patients, so we're not focusing on the preventative side because our patients have already been diagnosed with diabetes. So now what do we do? How do we move forward with their quality of life and making sure that they are able to manage their diabetes and also prevent other comorbidities, right? So the biggest emphasis that we know of and that is always advocated and it's always taught to patients is being active, right? Physical health, physical exercise, and eating well, nutrition, right? These 2 components is typically where we spend a lot of time with patients, and a lot of preventative programs or treatment programs for diabetes spends most of their time. And I know that most recently there was also a lunch and learn for nutrition. So we know that component, right? And we push for that. And that's those are also important because patients are able to, these are 2 components in which patients have control over, right? If they choose to exercise a little bit more, be more rigorous, maybe not exercise as much, they have control over that, as well as the medical treatments, right? Being compliant with their medications, always making sure that, again, they already have diabetes, making sure that they're taking those medications to help and assist with their dietary modifications, with their physical activity. And then remembering to talk to healthcare team. Patients are the biggest component for their health, right? They're the biggest components for the healthcare team. They are the most important part because they are the ones who are responsible, excuse me. They're the ones who are responsible for their health, right? They're the ones who take action. And then the last part is coping with diabetes. One part that always gets overlooked when treating diabetes or when advocating for their health is the mental health component, right? So that brings me to mental wellness. Often gets overlooked because it's something we don't always see. We can't always address this. We can't always assess it just by looking at someone, right? You actually have to go a little more in depth and ask a series of questions. So coping with diabetes can sometimes look a little different for all patients, right? So it's an important factor because it has to do with their mental wellness and when mental well-being. Being diagnosed with diabetes completely alters a patient's everyday life, right? Their current lifestyles are completely altered. They have a large number of dietary restrictions, and now they have to incorporate additional steps into their daily routine. So whereas before they could wake up, have whatever they want for breakfast, right? Or they didn't have to take into consideration what it is that they were going to be taking. They can move on, right? Or maybe skip breakfast or pick it up on the go. Now they're having to take into consideration that one, they have to wake up and check their A1C their sugar levels with the glucometers, taking their medication, right? Understanding that sometimes they have to eat breakfast with it or not eat breakfast with it, depending, and they have to take to consideration what they can't eat, right? Foods that they should be avoiding. And also addressing and differentiating between symptoms. So sometimes one common side effect for diabetic patients is numbness and tingling in their extremities, right? Upper or lower extremities. They need to distinguish if that's a side effect from diabetes or if that's a symptom from another illness or a condition that's happening, right? So all of that can be an added stress to patients. So the ability to be able to adhere to medication and be compliant to all of these things and recommendations also is affected by their ability to be able to handle, right, what's happening, this changes. And so this aspect is important because Elliott's cognitive behavioral therapy and glycemic control in diabetes article tells us that mental health problems are more common in people with diabetes, which are twice as likely to suffer from depression, which can create a further obstacle in order for them to take care of themselves. So as a BHC intern here, in a lot of the brief evidence interventions that I have with patients, the main purpose of them is to create a care plan with patients and meet them where they're at. Many times patients are not ready to make those changes, right? They're not ready to make those drastic changes. So physicians can tell patients that they need to cut out sodas, that they need to cut out high sugar foods, or to make modifications to their daily routine by incorporating more physical activity. But if a patient isn't ready to make those changes, there's nothing there's no good that will come from it. If the patient isn't willing or isn't ready to make those changes, they're not going to happen. So the biggest component during these interventions is first assessing where the patient is at and what they're willing to do, where they're willing to compromise, whether it be instead of drinking 3 sodas a day, cutting back and doing 2, or maybe they're not ready to make those changes, but they're thinking about it and considering it. So all those things are important components when we assess patients during interventions, and trying to figure out what's the best plan for them, right? So what's important to us is not always important to our patients, right? So we know the risks. These are topics that we are very well versed in. We know the risks of having diabetes, of not managing diabetes, what comes from it, right? Comorbidities, lower life expectancy, the quality of life that comes from it. And so sharing these statistics with patients can only do so much for them. So understanding that component isn't always going to do the trick for patients is important, and instead trying to assess how they're feeling about it and what we can do together to be able to move them forward and find something that works for them, that even if it's a small change can help them in the long run and be sustainable and create a long-term effect. Because once they have diabetes, this chronic illness is, it's long-term, right? It's something that they're going to have to manage and they're going to have to deal with for the rest of their lives. So being aware and validating their feelings about it is important, because there's going to be a lot of feelings that come with it, right? With them being diagnosed and knowing that, now that their life is going to be altered. So a lot of this work, a lot of what we do during interventions uses cognitive behavioral therapy in order to be able to shift mindsets, right? So the founder of the cognitive behavioral therapy is Dr. Aaron T. Beck. The main focus or the main purpose of this approach or this model has been to effectively treat mental health problems, and it's been used in randomized trials for diabetic patients. And there's been a lot of success that has come from it. A lot of patients are able to shift some of that mindset and are able to become compliant to medications, improve their current mental status or their overall well-being. So there has been a lot of success. And so we've been able to incorporate a lot of this. It's one of the more bigger focuses that we use when we do interventions. So this is a form of psychological treatment that has been demonstrated to be effective in a range of problems. So depression, anxiety disorders, alcohol or drug use problems, marital problems, eating disorders, and other severe mental illnesses. CBT helps you become aware of negative thinking. That's the main thing, is becoming aware of that negative thinking so you can view challenging situations, for example, being diagnosed with diabetes, and thinking more clearly and responding to them in a more effective way that will actually put patients on a path to create change, positive change, and better health outcomes. So numerous research studies have suggested CBT leads to a significant improvement. And so that's why I chose this emphasis for the mental health component. So you'll notice here, it's a cognitive triad. Again, the main purpose of CBT is to, it's a problem and goal solution oriented. So not everything will have a perfect solution, right? Not everything does, but like I said, creating those small changes and having a plan in general that works for the patient, that's adapted to the patient's lifestyle, is what will be important. So foundations of CBT. So the first part, we have a situation, right? So I'm just going to apply this model. So the situation in this case would be a patient being diagnosed with diabetes, right? So what happens? So I'm going to go through a scenario of what it would look like for a patient to have a negative outlook or have a negative perspective, and not necessarily completely negative, right? But they're not ready to make those changes. So a patient is diagnosed with diabetes. If their core beliefs are negative assumptions immediately, their automatic thoughts are going to be, again, negative. And it could look something like them, right, being judgmental of themselves, maybe thinking I should have taken better care of myself. Maybe I shouldn't have ate all those things before. This means my body is weak, things like that. And as we know, right, whatever we think affects how we feel. And so it'll affect their emotions, right? So now they're putting all these negative, they have these negative automatic thoughts. It's going to affect the way they feel. And this can present as either stress, anxiety, depression, a lot of guilt. A lot of patients feel guilty for having diabetes, or shame even, either from themselves, for feeling it from outside sources, outside relationships. And these emotions affect the way they behave, their behaviors, and whether they're wanting to make those changes. So if they're already feeling a lot of guilt, if they're feeling shameful, anxiety, they're very unlikely to engage in a lot of exercise recommendations, in making those dietary modifications, or even like being compliant to medications. And this will affect them overall, right? So this will continue to affect their physical health. So because we know that mental health and physical health are all in one, right? They're all interconnected. What we think, how we feel will eventually end up affecting their physical reactions or physical health. And this can present as them feeling lethargic, tired, numbness. And we know that this list is very, very extensive. So notice that this is a cycle. If they never break the cycle, if they continue to have these negative emotions about having diabetes, being diagnosed, it's not going to improve their compliancy, and it's not going to improve the way they feel. And then in turn will make them less likely to want to continue to make those changes, because they already feel tired. So what's the point, right? So what's the point of making those changes? What's the point of removing tortillas, of removing sodas, of reducing those numbers, because I have diabetes? It's not going to change anything. I already have it, right? So we're always looking for solutions. And so it makes it hard for patients to find a purpose in engaging in those changes, especially if they know that there is no solution. So that's where this becomes important to address. And so where this all comes from and draws from is core beliefs. And this is where we try to alter and shift that mindset, because those core beliefs develop very early on in life, right? We all know someone who has immediate negative thoughts, right? Or positive perspectives. For example, if anything happens, if something, your tire goes flat during the day, having immediate negative thoughts, it's like, well, now I'm going to be late. Now great, that's just another thing I have to take care of, right? Immediately just thinking about it in a negative perspective, rather than maybe, you prevented yourself, rather it happened now than in a situation, right, where it caused an accident, or, maybe there's another reason for it, right? Or just having a different outlook for it, that can immediately change and impact the rest of your day, right? You start off you immediately have those negative thoughts, it affects your overall well-being. So this is where we try to shift with patients, and this is where it can be important. And you don't have to be a counselor, and you don't have to be a BHC or have extensive knowledge on this, but just when talking to patients or when talking to individuals with diabetes, assessing where they're at is important. Assessing what having diabetes means to them and what they're ready to do, what they're ready to change, where they're able to make those changes. And it can't come from health professionals. It can't come from us. As much as we want them to make those changes, as much as we know that this is good for them, we can't force anybody to make those changes immediately, right? So presenting them with the information is one step, but then allowing them to create their own plan and deciding what it is that they want to change. Deciding what it is, where they want to compromise, what it is that they want to, what they feel is most important to them. So maybe they want to make those changes because they have children or they have grandchildren, right? And they want to be there for them long-term. So just trying to find ways in which to shift that mindset is very important. And that can be done just by talking to patients, right? Instead of perhaps judging them, right? Because they already have diabetes, right? And again, it's not always lifestyle. Sometimes it is genetic. Sometimes there are other risks. It's multifactorial when patients develop diabetes. So just understanding, validating their feelings and understanding that they're not always ready to make those changes. So starting small can make a big difference in the overall health of patients and improve their quality of life. So the last step is getting routine care to stay healthy. Again, they already have diabetes. So how do we manage and how do we move forward? So these are just the medical components of routine care. So it's recommended for patients at each medical visit, making sure they get that blood pressure check, making sure it's part of that ABCs, right? Making sure that they are maintaining a certain, staying under a certain range, foot check, weight check, and review of self-care plan, always adapting it because sometimes patients improve and sometimes they regress. So just making sure addressing that we're adapting it as they go, right? And staying flexible. And then 2 times each year, at least, this is the minimum because some patients have higher A1C. So it's important to check on that a little more often. And then once a year, cholesterol test, complete foot exam, dental exam, right? Dilated eyes, flu shots, and urine and blood tests for kidney health. Again, because these are all things that affect diabetic patients in different ways. And these are my references. Here are some extra resources for HOPE. And then just a quick information announcement. HOPE is having their 15th annual mental health training that'll be going on May 6th. So everybody's welcome to attend. Here are the registration details, and you can find more information on our website. So a special thank you to Unidos contra la Diabetes, Ms. King, Ms. Roxanne Pacheco, our Executive Director, Ms. Angie Espinosa, our Integrated Behavioral Health Director, Yahaira, who is also the other BHC, who has done a lot of my training. So thank you, everybody.
Awesome, Hilda, thank you so much for a great presentation. This has been absolutely amazing and extremely informative for us. So now if anybody has any questions that they would like to have answered, please feel free to put them in the chat. I will be more than happy to read them out and we will continue on. We will be having our next Lunch and Learn on April 22nd, I think is the date, in 2 weeks, with a little bit more information on holistic health. So you're more than welcome to attend. We will be sending out the registration forms for that soon. All right, everyone. Well, I'm not seeing any questions come through. So Hilda, thank you again so much for this presentation. This has been absolutely wonderful. And also we will be putting these presentations on our website under our resource side at ucdrgv.org. So if you would like to rewatch this, or if there is something else that you would like to go back and revisit, you are more than welcome. I do see a question that popped up. Oh, it's a thank you. All right, everyone. Thank you guys so much. And if you have any questions, please feel free to reach out to us at any time. Otherwise, we will see you in 2 weeks. Thank you, everyone.